Hello everyone. In this video, I am going to talk about common ultrasounds and genetic investigations that you have access to in the first half of your pregnancy. So starting off with the first trimester ultrasound or dating ultrasound. So a first trimester ultrasound is the most accurate way that we have to estimate the due date for your baby to be born. This is because a fetus grows at a very predictable rate at the beginning of a pregnancy, and it isn't until later on that your genetics come into play and affect the size of your baby. First trimester ultrasounds with a crown rump length, so that's a measurement from the top to the bottom of the baby, between 10 millimeters and 84 millimeters provides an accurate due date to within 3 to 5 days. A known last menstrual period may be used to date a pregnancy if you choose not to have a dating ultrasound. Using a last menstrual period to date your pregnancy requires you to have a regular period and for you to be sure of the date. However, this typically underestimates a due date by about 2 to 3 days when you compare it to a first trimester ultrasound. If you became pregnant with the help of reproductive technology, this can be used to date your pregnancy based on the procedure. If more than one first trimester ultrasound is done, then the one that is closest to but above 10 millimeters, so about 7 weeks gestational age of crown rump length, should be used to date your pregnancy. If your dating scan was done earlier and the crown rump length is less than 10 millimeters, it may be considered too early to use for accurate dating. Any dates that you receive after the official dating scan are reflective of growth and do not change your estimated due date. Early second trimester ultrasounds may also be used to date a pregnancy in the absence of a reliable last menstrual period or first trimester dating scan, but it is much less accurate and it gives a window of about a week. A quick note on due dates. Your estimated due date is considered to be the date of your 40th week of pregnancy. A full-term pregnancy actually runs between 37 weeks and 42 weeks, so you have a bit of wiggle room in there to have your baby. For first-time parents, statistically, you will have your baby around 40 weeks and 6 days. Second babies often come a couple of days earlier, and third babies are wild cards and they like to keep us on their toes. The anatomy scan is a routine ultrasound that is offered between 18 and 22 weeks gestation. It provides information about fetal sex, anatomy, and the location of the placenta. It is a longer scan that looks over the baby from head to toe. Learning the fetal sex is optional. If you wish to learn, assessment by the ultrasound tech is about 90 to 95% accurate. Visualization does depend on how cooperative your baby is being. The anatomy scan looks for congenital anomalies like spinal defects or signs of chromosomal or genetic differences. Because of this, it does function as a type of genetic screen. Sometimes features appear on ultrasounds called soft markers. Depending on the feature identified, there may be an increased risk of fetal chromosomal differences associated. It is important to know that often soft markers appear in healthy pregnancies and are considered to be a variation of normal. If a soft marker is identified on your scan, your midwife will review it with you in detail and review any of the recommended follow-up. This may include a repeat ultrasound or a consult with genetics or an obstetrician. Often, there may be no recommended follow-up at all as your baby's risk remains low. Examples of soft markers include echogenic intracardiac focus, so a bright spot seen in the baby's heart, choroid plexus cyst in the baby's brain, an echogenic bowel, so a bright spot seen in the baby's intestines, an increased nuchal fold, so an area on the back of the baby's neck that we measure, or ventriculomegaly, which is an enlargement of an area of the baby's brain. Your placenta will also be examined for position, appearance, presence, or absence of abnormalities. Placental location and its relationship to the cervix will be measured. If it is covering your cervix or closer than 2 centimeters from the opening of the cervix, your midwife will recommend repeat ultrasounds later in your pregnancy to assess its location. It is important for your cervix not to block the exit of your uterus, and that's how we normally plan for the baby to come out. Luckily for us, the way the uterus grows usually brings the placenta out of the cervical area. Amniotic fluid volume should also be assessed, and your uterus will also be examined for any fibroids or differentiation in uterine physiology. So in your first trimester, you have the option to have genetic screening done. to assess your baby's risk of having a chromosomal anomaly like Down syndrome, which is trisomy 21. Genetic screening, it's a very personal choice for many people. Some people choose to do it because the result would impact their choice to go forward with their pregnancy. Some people want to do it so that they can have all the information they can have to prepare for the needs of their baby. And some people choose not to do it as they want to enjoy their pregnancy and meet their baby when they arrive. I recommend talking with your partner or your support systems and making the choice that is right for you and your family. So, early first trimester screening is a routine genetic screen that uses your demographic information combined with the nuchal translucency measurement, which is an area at the back of the baby's neck, on an ultrasound, and blood work done between 11 weeks and 3 days and 13 weeks and 6 days. So, the blood work and the ultrasound need to be done on the same day for this screen. Early first trimester screens for 3 variations in chromosomes that result in Down syndrome, Edwards syndrome, and Patau syndrome. This is not a diagnostic test. A positive screen does not mean that your baby has a diagnosis, and a negative screen does not guarantee a normal pregnancy. What it is an individualized risk ratio report. So a screen positive, for example, indicates that your baby has a chance of having Down syndrome of greater than 1 in 350. Early first trimester screening has an 80 to 90% detection rate and a 3 to 6% false positive rate for Down syndrome. If you miss the window for early first trimester screening and still want genetic screening, maternal blood sampling, called a maternal serum screen, can be done between 15 and 20 weeks. However, it is not as accurate as the early first trimester screen. It sits at about 75 to 85 detection rate and a false positive rate of 5 to 10% for Down syndrome. If screened positive, so with the early first trimester screen, a screen of higher than 1 in 350, a consult with a genetics counselor will be offered, and further diagnostic testing like chronic villus sampling or amniocentesis, or commonly a non-invasive but more sensitive screening may be offered called non-invasive prenatal testing. The counselor will walk you through the options and help you decide what is best for you and your baby's clinical picture. The non-invasive prenatal test is a screen that may be accessed by some people through genetic counselors if they receive a positive early first trimester screen, but it can also be accessed without doing the early first trimester screen. So what this is it is a blood test for the parent, for the birthing parent, and it analyzes circulating cell-free fetal DNA that is present in your blood. It screens for trisomy 13, 18, and 21, same as the early first trimester screen, and it also screens for sex chromosome differences, so X and Y chromosome differences. It has a very high detection rate and a very low false positive rate. So for Down syndrome, trisomy 21, the detection rate is 98 to 99%, and the false positive rate is 2%. It's one blood draw, it's done after 10 weeks gestation, and it requires a dating ultrasound to ensure that the date is accurate. It's offered, like I said, after a positive genetic screening. It's not typically our first-line screen. However, the Ministry of Health does fund the non-invasive prenatal test for people who meet the following criteria. So people who are over 40 years of age, or older at the time of delivery, if you have a nuchal translucency measurement on ultrasound that is over 3.5 millimeters, if you've had a previous pregnancy with a chromosomal anomaly. So you can also pay to have this test done out of pocket. It runs at about $550, so it's quite expensive. And some people opt to do this through their family doctors, either because they want the most sensitive screen possible or because they want a screen earlier. Like I said, this one you can be done after 10 weeks gestation, whereas the early first trimester screen requires you to wait until the 11th week of gestation. It's still not a diagnostic test, but it is a very accurate screen. In a normal healthy pregnancy, as far as surveillance goes, your anatomy scan will be the last ultrasound ordered. Others will be ordered only if there's an indication, such as assessment of growth, confirmation of fetal position, or if you go past your due date. We will call you after any scans or tests if there is something that requires follow-up. This does not always mean that something is wrong. Sometimes your baby was just in a stubborn position and the technician couldn't see their face and is recommending a repeat scan. All normal results will be reviewed with you at your next visit, including fetal sex, if this is something you are hoping to find out. A little note about keepsake ultrasounds. I know that 40 weeks and sometimes 41 or 42 is a long time to wait to meet your baby. But please keep in mind that although ultrasounds are considered to be a safe procedure, they are a medical assessment and should be done based on clinical indication. If you go outside the medical system to get a 3D ultrasound and the person performing the scan sees something they are not comfortable with, they might not have the resources to provide you with information, support, or follow-up. In those cases, you might need to come back to us, your midwives, for another ultrasound. This can result in unnecessary anxiety and concern. On the flip side, commercial ultrasounds may also result in false reassurance if the person assessing the ultrasound isn't a trained medical professional. So honestly, like everything else in midwifery care, it's a choose your own adventure fueled by information. If this is something you are going to do, please do your research on the clinic and let your midwife know of your plans. So as always, there is some information about ultrasounds and genetic screening pasted below in the video description. And please take your questions to your midwife. They'll be happy to discuss them with you.